Welcome back to HealthWise. With us is my special guest, Dr. Kerry Thibodeaux, the medical director at the Wound Treatment Center. Not Wound Care, Wound Treatment Center in Opelousas. He said emphasis on the.
On the, that's it. We are the Wound Treatment
The Wound Care. Doc, we were talking, and I know from previous talks and stuff, Wound Treatment Center in Opelousas does just a tremendous amount of wound care. You know, I mean, I think you are probably do more wound treatment, wound care than anybody else in the area. I mean.
Well, yeah, we have a very large multidisciplinary clinic, and we've been around for a long time, and because of that, we've been able to cultivate a lot of relationships with the physicians and with other healthcare providers and physician extenders, nursing homes, LTACs, and so we have a constant referral stream for patients that need us, and I think last year we did right at 16,000 visits. So
wow.
It's well over.
It's tremendous.
It's well over 1,000 visits a month, and you know, we do all the inpatient wound care at the general as well, which takes a huge burden off the nursing staff because they can concentrate on the other aspects of acute care that those patients need, and they don't have to worry about the wound. Our team comes in, does all the wound documentation, does all the dressing changes, and then if they see something that they think needs to be addressed, they can relay that directly to the primary physician on the case and the wound doctors monitoring that. And so it's been a very good service for the hospital. And that then leads us to the vast experience we have with a lot of advanced therapies. One of the ones we've been really lucky to get access to is Apligraf. It's the only bilayered bioengineered skin. It's been available since 1998, and we were one of the first centers to have access to it. And I've personally applied over 3,000 Apligrafs, which accounts, I found this out today, for 1% of the total utilization of this product. 1% is right here in Opelousas.
And when you talk about that, some people that's looking in the audience may say 1%, that's nothing. But you have to think, that's 1% of the total. That's worldwide.
That's right. 1% of the entire utilization of Apligraf on the planet Earth has occurred right here in Opelousas.
Little old Opelousas. Who'd have thought? You know?
So there's no doubt that we have a tremendous amount of experience. And the company that manufactures Apligraf, which is Organogenesis out of Canton, Massachusetts, they have been trying, as part of their corporate policy, to interact with every Medicaid program of every state in the union to convince them to fund Apligraf at its cost, which is like $1,500 for a piece of Apligraf. With the caveat that allowing physicians access to this advanced therapy will help heal wounds faster and help prevent amputations. And the data is extremely compelling on this. There were 2 prospective clinical trials that were done under the FDA rules, which cost this company millions of dollars to do, in order for them to prove beyond a doubt that this therapy is superior to any of the standard therapies that were utilized. And so much so that the cost savings can be astronomical, especially when you start preventing amputation. And so Organogenesis has gone from state to state, doing presentations to each state's Medicaid program, because each state controls their funding. They've now come to Louisiana to do their presentation. And I was fortunate enough to be asked to be the physician representative for the physicians of the state of Louisiana to make a case for why Medicaid should fund Apligraf. And so I was able to share some stories with them, as well as give them my own personal data, you know, because we have such a large volume. You know, of those 16,000 visits, 30% of them are Medicaid patients. Medicaid patients don't have access to a center like this anywhere in the state, because a lot of hospital-based clinics in bigger areas don't accept Medicaid,
Right.
you know, or they don't want to have a big Medicaid presence because there's really not enough funding. So it tends to be more nonprofit hospitals and more community hospitals that are really engaged. And so and that actually is a reflection of the population. You're looking at
Right.
about 30% of the people in the area. So, and those patients, if they have a diabetic foot ulcer or a venous leg ulcer, we cannot use Apligraf on them unless I beg the company to give me a piece, or if I, you know, figure out a way where one's expiring somewhere and we've still got a day to go, so it's still a viable product.
Right.
But rather than let it go to waste, I can get it directed this way through a program that the company has to prevent product from expiring, because it is so expensive. And what I was able to show them is that our amputation rate amongst private insurance patients is almost zero. But of the 30 amputations or so that I actually do a year, a large percentage of them are Medicaid patients, and Medicare with Medicaid as a supplement, which means that the Medicaid doesn't pick up enough of the costs when you have Medicare and Medicaid. If the allowable for Medicare is greater than what Medicaid allows, then Medicaid doesn't have to pay anything
Right.
on that claim. And so things like Apligraf and other therapies are not funded so that those Medicare, Medicaid patients don't have access to it. And so I told them, quite frankly, I didn't think it was an accident that so many of my amputations are done on Medicaid and Medicare, Medicaid only. And that's in spite of our best effort at providing them with the services that we do have that are funded, like hyperbarics and antibiotics.
Right.
And I also made the case today that in the patients that have venous leg ulcers that have Medicaid, those patients end up staying in the clinic longer. It takes me longer to get them healed than it does patients who have access to things like Apligraf. And so the message was that you're paying for a lot. You know, these patients are coming to the clinic longer, you know, and yeah, you're telling me we'll pay you that $80 for that visit. Well, if it takes me a year or two longer to get the patient well, then you spent more than $1,500.
Right.
And so I even gave them suggestions as to how they could see if they could justify it. All they need to do is look at all the claims to Medicaid for venous leg ulcer. And you know they use all those codes now. So they just punch that in. And they can get a dollar amount on what they're spending.
Each one.
And there are studies, and I cited several of them today, that show that you can reduce the cost of venous leg ulcers by 25%. So it shouldn't take them long to figure out how much they're spending on venous leg ulcers and what a 25% savings would mean. Now, on the diabetic side, the amputation rate for diabetics with an ulcer is upwards of 20%. But if you have access to Apligraf, in the study, it was only 6%. So that's a 14% reduction in amputation rate. Now, amputations are expensive, up to $50,000.
Sure.
And I asked them today at Medicaid, I said, do you cover prosthetics if a Medicaid patient gets an amputation? And they said, yeah. I said, so you'll pay for a prosthetic after an amputation, which costs $20,000, $30,000. You know what those things cost. But you won't give me $1,500 for a piece of skin that was grown in a lab that I could prevent all that with.
That doesn't make any sense at all.
Well, it seemed that they got the message because the medical director for Medicaid then directed his staff to run those numbers. They took my suggestion. Look at what the cost to Medicaid for the state of Louisiana and the taxpayers of Louisiana is for venous leg ulcer therapy, and factor in a 25% reduction and then tell me that that's not worth it.
Sure.
Look at the number of amputations on Medicaid patients. Medicaid can tell you how much money got paid out for amputations.
Sure.
And then you look at a 14% reduction in those amputations, and you factor in all, because Medicaid gets the DME bill, and they can look up their DME code. So their lights were clicking and they were running, and so I'm hopeful.
Well, I hope we're able to do something. I hope I'm pretty sure, you're a persuasive speaker, so I'm sure you will be able to convince
Well, it's hard
them
to argue with the math.
Sure. And it's just, you had it right there. You had the numbers. Doc, after we come back from this brief message from our sponsors, we'll talk a little bit about your adventures today in Baton Rouge.